Hi, I'm Dr. Noelle Lucas from Blue Oasis Pet Hospital, and I'm here to answer some questions that you have about dog anesthesia and some additional questions that have been brought up. So I have them to be asked right now.
Dr. Lucas, what kind of anesthesia is used for my dog?
So the type of anesthesia that we use here is generally we use gas anesthesia in the form of isoflurane. So we intubate your dog, we get them under anesthesia, and we maintain them on gas anesthetic. That's the most common that we use at Blue Oasis.
How is it? What's the difference between anesthesia, sedation, and general anesthesia?
So sedation is just immobilizing your dog so that they aren't able to move a whole lot while we do a procedure for them. So we might sedate your pet if they have a lot of fear, anxiety, and stress. Even in the exam room, if we're just doing a physical exam and maybe doing some vaccinations and maybe just need to get some blood work, we might prescribe a sedative, or we might give an injectable sedative. Those patients are still somewhat conscious, even though they're fairly really sedated, but they are able to have some normal reflexes. They may still be able to control some of their body. Those are pets that are really sedated. Depends on the sedation that we give. Sometimes they're really, really sedated and they don't have any real consciousness at the time, but they're not intubated, and the time that we have them sedated is for a controlled period of time. And often we can reverse some of those sedations so that they can basically come back up to consciousness and walk out of here very quickly. Gas anesthesia is different. That's a intubation, so they're tube put down their throat, they're put on an anesthetic machine, and then the length of time that we have to do our procedures can be controlled by us, potentially much longer.
Will my dog need an exam and lab work before anesthesia?
Yes, absolutely. Your dog cannot just come into Blue Oasis Pet Hospital and for a procedure, for example, a dental procedure or a surgical procedure, without having talked with, been seen by a veterinarian. We've gone over the concerns that you have about anesthesia and surgery. We've talked about what they need. We've assessed them as a general patient. They've had a physical exam. We've looked to see if they've had blood work. We mitigate the risk that we have. So absolutely, your dog needs to have a doctor partnership before we move forward with anesthesia and surgery.
What kind of pain medications will my dog receive before, during, and after?
So the type of pain medication really depends on the type of procedure we're doing. The most common would be an anti-inflammatory. So we're going to give that pet potentially an injection of an anti-inflammatory and then send that anti-inflammatory home as an oral dose to give. So some common examples would be for a dog would be carprofen. The trade name is Rimadyl. Another one could be meloxicam. You and I know it as Mobic, so we use that both orally and injectably. Other pain medications that we use would be narcotics, so really opioids like hydromorphone, torbugesic, buprenorphine. Those would be good examples of true pain relievers. We're often not going to send those home with you because those are narcotics, but we can prescribe Tylenol with codeine for your dog, especially if they've had some major oral surgeries or they've had a real painful bone procedure, just a real big abdominal procedure, for example, like a foreign body removal. So those would be common, like go-home pain relievers that we use. We also use local nerve blocks. For example, lidocaine would be a good one that you guys all know that we use as well. So we'll like numb the surgical sites. So those wouldn't be go-home, but those would be other things we're doing to mitigate pain while they're here.
Generally, how long do these procedures last?
So a dog neuter would be a good reason for us to have a dog under general anesthesia. That dog would probably be under general anesthesia, probably no more than half an hour, 45 minutes on average, depending if it's a small dog. Now, if it's a much bigger dog, they might take a little bit longer. A dog spay may also only take us maybe about an hour or so general anesthesia time. There are dog dental procedures where we do extractions or multiple extractions in the mouth, and those patients sometimes can be under general anesthesia up to like 3 hours. So it just depends on what type of surgical procedure we're doing and how long anesthesia might need to be last, basically. So if you have any more questions or that you would like to ask specifically about your dog's general anesthesia and risks or safety or what we do, we invite you to reach out and ask those questions to us at Blue Oasis. Thank you.